Today we are talking about the third stage of labor. Third stage of labor. This might be a term that you're not familiar with, though you might be familiar with what's involved in the third stage of labor. So, the third stage of labor is the birth or delivery, you might hear it either way, of the placenta. So the first stage of labor is our dilation, effacement, and opening of our cervix. And then once the cervix is totally thin, totally opened, then we move on to our second stage of labor, and that is the pushing stage, when we're actively pushing out the baby. And then our third stage of labor is the delivery or birth of the placenta. So I actually have nearby my childbirth ed tools. It's a stage that is kind of, not discussed as much. This part, the baby, and dilation and effacement and pushing is generally the first and second stage of labor is generally the part that we focus on when we learn about labor, when we talk about it. But along with the baby, we get a placenta. So these are some of my childbirth teaching tools. Here is our placenta, and we have an umbilical cord like this. So the third stage of labor is when our placenta is, the first thing it has to do is detach from the wall of our cervix, the wall of our uterus. So the placenta is attached inside the uterus, and through a series of hormones, after the baby is born, the body tells the placenta that it's no longer needed, and that where it's attached to the wall of the uterus and it detaches. Now, this usually happens within the first, I think it's generally about 5 to 30 minutes after the birth of the baby, the placenta detaches. And there are a couple of things that happen when the placenta detaches. First of all, there is often a small gush of blood that can be seen to come out. And if your care provider is watching, your midwife or your OB, they will notice a trickle of blood sometimes can indicate that the placenta has detached. Also, sometimes when the placenta detaches and kind of drops down in the uterus, it's not pushing, but the weight of the placenta is on the cervix. And sometimes the birthing person will feel like that urge to push, or just feel kind of like, something else is going on in there. I sort of feel like pressure, sort of feel like I need to push. Sometimes that can indicate that the placenta has separated. Also, when the baby is born, and generally will be put, in arms of mom, and the cord is often still attached. Now, it really depends on your care provider if when the cord is clamped and cut. Years ago, we would see regularly that the cord was cut very quickly upon birth of the baby, and we're seeing more and more of delayed cord clamping, and we'll probably cover that in depth on another topic on the wheel. But delaying the cord, it gives us more time that we're allowing the baby to be attached to the placenta before we cut the cord. So if you're holding baby, the cord is still there and the placenta is still inside, your care provider might notice that more cord comes out, sort of drops down, and that usually means that the placenta has detached. So delivery of the placenta is really important because in order to stop the bleeding that happens, the uterus has to contract down. So the uterus is, fairly large sized when the baby's inside with the placenta. When the placenta detaches, there is basically like an open wound. And what needs to happen is the uterus needs to clamp down and almost shrink back to a very small size. It's such an amazing feat to go from, this large muscle that's holding the baby down to this, orange sized muscle. But what the purpose of that is really to stop that bleeding. And so the third stage of birth, while it might not be as exciting as the first or second stage, it is super important. So a couple things to know, especially if you are supporting someone, if your partner is going through birth, remember that, that really your care team is going to be very present and really active until that third stage is complete. So until the placenta is out and the uterus is clamping down properly, firming up properly. You might hear nurses or care providers talk about that the uterus needs to firm up, become firm. So that is really what's happening with the after the placenta comes out. And sometimes if we see a hemorrhage, which is excess loss of blood, it is during this third stage of labor. So our care team is going to be really present during this time, still looking to make sure that everything is going normally. And you might not notice what's going on if you're holding baby and, meeting your new baby and everything. You might not even notice the placenta comes out, or your care provider might say something like, give me a little push or bear down a little bit to birth the placenta. Now, if you have never seen a placenta or would like to see what your placenta looks like, and you might not. Okay, so it's quite bloody. It looks a lot like a piece of meat. You might have no interest in this at all. But I want to just say that if you do have interest in it, ask your care providers if they can show you the placenta before they take it away or put it away. It's something interesting, and being a doula and childbirth educator and having conversations around this field, I have heard mothers, and even mothers of older children, high school age children, say, oh, I didn't even see my placenta. I wish I could have seen it, which is a funny conversation to have at high school drop-off. Anyway, or middle school drop-off. But if you have any interest in it, talk to your care provider and say, hey, can I see the placenta? And usually they will pick it up and show it to you and maybe explain, like, this side was where the baby was, this side was attached to the uterus, and that kind of thing. Also, if you are someone who is going to encapsulate your placenta, that is the time to make sure that your care provider, doesn't take your placenta away. So your support team should be on top of that, make sure that everything is taken care of to take the placenta home with you or get it picked up for placenta encapsulation, which is also something another topic we can dive a little deeper into on another Big Villa Birth topic. So third stage of labor is very important because it is the delivery and birth of the placenta and the firming up of the uterus. The other thing I wanted to mention that can be surprising for people for firming up the uterus, it depends on your care providers, but a lot of hospital-based providers and nurses, their procedure is to do some manual pushing down on your uterus to help it firm up. If you push on it, it can help firm up, especially if you have an epidural. You'll see providers are often pushing on it. It can be a little painful sometimes. It can be a little distracting. The purpose of this is really to help your uterus become firm and stop bleeding. So if it is uncomfortable for you or bothersome because you're holding your new baby and you're like, why are you pushing on my stomach? Just know that you can always use your childbirth techniques. I really recommend some real big deep breaths during your uterus being pushed on, your fundus, the top of the uterus being pushed on. You can use your childbirth techniques for this too if it is painful. And just remember that your care providers are doing this really to help prevent postpartum hemorrhage and really stop bleeding. So it's important, just sometimes uncomfortable. So third. Wow, it's funny because we talked about this yesterday a little bit. So today's topic is placenta. So, and I still have my bag here of childbirth education tools. It's just, just a baby's leg hanging out. We've got our baby. But more importantly, we have today's topic, which is the placenta. So the placenta, yesterday we covered the third stage of labor, which is the delivery or the birth, whatever you want to call it, of the placenta, which comes after the birth of the baby, right? So the baby is attached to the placenta via the umbilical cord. Now, I'm going to try to find a picture and see if I can include it on the video in YouTube. So I did have the experience a couple years back at my children's middle school science class to bring in an actual placenta that was donated by a doula client of mine, or two actually, to show the students an actual placenta. So it was pretty exciting, and most of the kids found it fascinating. So the placenta, it starts off when a baby is created, cells differentiate and they start forming the placenta, and the placenta is attached inside the uterus to the uterine wall. And what the placenta does is it acts as a filter between the mother's blood source and the baby's the mother's blood source brings in nutrients and interacts right there at the placenta at the wall of the uterus, and then the nutrients are delivered through the bloodstream, through the umbilical cord to the baby. So sometimes you'll hear people say like, oh, I had chocolate and the baby really reacted to the sugar, started kicking around in there because of the sugar. Well, what happened was the mother ate chocolate, digested the nutrients, the sugar went into her bloodstream, and then her bloodstream sugar transferred through the placenta to the baby. Now, what's interesting to note is that the placenta, it is awesome in that sometimes it protects us from things that are bad for us. So the placenta can actually filter out certain viruses and infections and keep the baby safe. But there's other things that pass through to the baby. So some of the chemicals that are found in smoking, so if the mother smokes while she's pregnant, the placenta isn't able to filter that out, and that is transmitted through the placenta to the baby. And other things like, harsh chemicals can be transferred that way, or medicines, medications, and that kind of thing. So the placenta, while it is pretty awesome at keeping some things away from our baby, it doesn't filter everything out. And sometimes you'll hear things, you might hear the term, does it cross the placenta? Does it cross the barrier to the placenta? And that's what that means. So epidural, for an example, it is unlike IV pain medications that might be taken in labor, in that the medication does not cross the placenta and reach the baby. So whereas IV medications, so if you decided to take a narcotic like a Nubain or morphine or something like that, the baby could feel the effects of the IV narcotic, because the placenta, it does cross the placenta. So it's something to think about when you're thinking about your choices for labor. But the placenta comes out after the baby is born. The body goes through a series of hormone changes that tells the uterus to release the placenta. So where the placenta is attached inside the uterus, the uterus lets go of the placenta. The placenta drops down, usually right on the cervix, often feeling kind of pressure for mom, that you bear down and deliver the placenta. Now, one question I've had about the placenta is, does it hurt delivering the placenta? Like, what does the placenta feel like? So the good news about this is there's no bones in the placenta. Obviously, this is fake, but bones and muscle, no bones. So a lot easier to deliver the placenta. It is important that the placenta comes out in its entirety, because if any pieces were left inside the uterus, the placenta, it gives off hormones, and it can have an effect. Those hormones that the placenta has can have an effect on the production of milk for breastfeeding. And so usually after the placenta comes out, your care provider will do a quick check to make sure that it came out in whole, that they can see there's no broken edges, that it's has come out altogether. So that's really important. There are a couple of things that are risk factors for giving birth with the placenta. Well, there's one main one where when the placenta starts growing, attaching to the uterus, if the placenta attaches to the bottom, like right over the cervix, so that if you can imagine, the cervix has to open. If the placenta attaches above the cervix like this, and we've got baby up here, the baby cannot be born vaginally. There has to be born via a cesarean birth, because we need for the baby to have full access to the placenta for the entire time that until the baby is born. So the placenta cannot be born before the baby, and this is called placenta previa. So if you're diagnosed with placenta previa, it would mean that you would need your baby would need to be born via cesarean birth. Sometimes a placenta can be a low-lying placenta, which is where it is attached on the lower segment of the uterus. And as the uterus grows, the placenta will move away from the cervix often, not always. And if you have been diagnosed with a low-lying placenta, your care provider will often do some extra ultrasound scans to check and see if that placenta has moved away from the cervix. If it has, generally you will have the opportunity to birth vaginally. If it is still blocking the cervix, then a cesarean birth is how your baby will enter the world. So the placenta is super important, and it is interesting to note a couple other things you might hear your care provider say about placentas. Sometimes you might hear, oh, I have an anterior placenta. And what that means is that if you can imagine the uterus being like a ball like this, an anterior placenta would be when the placenta attaches to the front side of your uterus. So it is on the front side of your belly. And if you have an anterior placenta, the one thing that you might note is that you might not feel big kicks and movements like other people might feel, because your baby is actually kicking through the placenta, which is fine. But you might not feel those big movements like maybe you have friends or family that talk about, oh, I see elbows pass and knees pass. If you have an anterior placenta, you might not notice that. The other thing that you might hear about placentas is if the placenta, there is an issue that can happen. It is rare, but it is when the placenta does not detach well, and it actually grows into the uterus, and it's called placenta accretia. And it is a very serious condition that usually requires surgery immediately after a birth. And that is why making sure that our placenta comes out is what our care providers are really focused on after the baby is born. So if you you notice, if you're the support person, notice that your nurse and your doctor and your midwife might be really trying to make sure the uterus clamps down and looking at the placenta and talking about it, it's because it is a very key part of the health of mother to make sure the uterus clamps down and make sure the placenta leaves in its entirety. So that is a lot about the placenta. Ooh, this is an exciting one. Breathing. So if you didn't hear the story on how this got on the wheel, I'll share after we talk about breathing. So breathing in as it applies to childbirth is, I always like to talk about breathing as the foundation of our coping strategies in labor. So if you think of coping strategies for labor, kind of maybe like a cake, breathing is always our bottom layer of the cake. It is our most foundational. You can use it at all times, at any time. You can, no matter what's going on, it can help you cope during the process of labor, birth, and postpartum. So, of course, we're always breathing, right? But what this kind of breathing is really intentional breathing. And as a Lamaze educator, I am particularly excited about breathing. That was a foundation of Lamaze when Lamaze really got started. Nowadays, Lamaze teaches all different types of methods and really has a great curriculum that I enjoy teaching. But breathing has always been the foundation of it. And my favorite type of breathing to teach is slow, intentional breaths. A lot of times when we're anxious or nervous or scared about things, we do a couple things. We either hold our breath and we don't even realize it until we need that air and have to breathe out, or we do a lot of little shallow breathing, kind of short breaths, and neither of those are good at calming our nervous system and relaxing our body. And so when you think about using breath for labor and coping in childbirth, I want you to think about really filling up your lungs nice and full and slowly, pausing for a second, and then exhaling slowly. Now, I get this question a lot, and it's, do I breathe out of my nose or my mouth? And my answer is really whatever is comfortable for you. Some people are more comfortable with nose or mouth, and whatever works. And you can change it up. A lot of times I like to breathe in through my nose and out through my mouth in labor, and practicing for childbirth and teaching childbirth. When you blow out with your mouth, I feel like you have a little bit of more control of the slowness of the exhale. So what it looks like, and you can kind of put your hands here just to feel what it feels like to really expand your lungs and take a big deep breath in. So what it would be inhale, pause, slow exhale, in, pause, out. Now, this is super simple, but it's something that we really forget when we're scared, nervous, stressed, experiencing labor. So, partners, this is where I need you to help out here. And if you are watching this video and you are the pregnant person, grab your partner, pause the video, go get them, and let them hear this part. Partners can help so much with this pattern breath by breathing loudly next to the person in labor. So what breathing loudly looks like might be like a big sniff, a big blowout. Maybe even make that loud noise at the inhale. And hearing that slowness of your breath next to the person in labor. The person in labor, when they hear that breath slow, that pace, they can start matching the rate and the speed of that breath. You can even say little short phrases, because when someone is experiencing a contraction, you don't want to jibber jabber. You don't want to talk a lot. So you might say, nice slow inhale, slow exhale. So just very short phrases. So partners, pay attention when the contractions are coming. Is she holding her breath? If you feel like she's holding her breath, you yourself might make a loud just to remind her to exhale, to let go of that breath. You could do something like this, just to remind. Now, again, this is great at any time in labor. That is your foundational tool. So even if you are in a C-section, yes, you might not be experiencing pain, but you're certainly experiencing oftentimes anxiety, fear, and a breath needs to be paid attention. It can be a really great coping strategy. Even if you are using other techniques, say you're using water, you are on a birth ball, we always have that breathing, that nice slow breath. You can also do patterned breath, which might be like a something like that. You can make it up. Sometimes those little rhythms, those little patterns are stuff that we can grab onto and really use for coping in labor. But what I think is really important to make breathing be such a strong coping mechanism and such a strong, powerful tool when we're in labor is to practice. Practice some of this before you go into labor. So, and you can always practice with your partner too, just like, let's just do some slow breathing. Okay, it's gonna feel weird maybe to just sit around and practice these long breaths, but I don't know about you, the more I practice, the better I am. I mean, if I haven't played piano in 10 years and I sit down and play the song 10 times through, I'm gonna be better at the 10th time than I was at the first, right? Just do some practicing. I recommend, if there's some kind of activity you like, I'm going to say a bath. Say you like to take a bath. Practice that breathing in your bath. Say, I'm going to do 10 long breaths in and 10 in and outs. And get that feel of the rhythm of it and the power of it. Maybe it's even at a stoplight. Take those to nice long breaths at the stoplight, in and out. And as you're doing that, you can even start thinking about relaxing your whole body, just being nice and limp and loose. That goes really nicely together with breathing. So practice your breathing. It can be so key and foundational. And partners, support team, make sure that you are helping use that strength of breathing as a coping technique in labor. Hey everybody, back again for the spin of the big wheel of birth, and I have to start before I spin to share a story that is so funny to me, especially if you are someone who is a birth worker or doula, and a birth worker, a doula, childbirth educator, and you have kids that hear about it all the time. So I have an almost 10-year-old son. I'm going to change the video just a little bit while we're talking. And he's my youngest of 4. Anyway, he hears about birth a lot. And yesterday he was in my office here and he knows about the wheel. And he said, "Oh, you have a blank space on your wheel." And I said, "Yeah, I took off the one that I did yesterday." And he said, "Well, what happens when you have all blank spaces?" And I said, "Well, every time I take one off, I add a new one." Okay. So I'm at the computer working, and he said, "Well, can I write a new one for your wheel?" Where did I put it? Oh, here it is. And I said, "Sure. Yeah, whatever." And so he wrote he didn't spell it right, but he wrote breathing, he wrote it Breething. And I said, well, that's a really good one, but I'm sure I have that one. Especially being a Lamaze childbirth educator, we talk about breathing a lot. Not only breathing, but breathing. And I said, well, I'm sure that's on the wheel. Check it. And so he goes over and checks it. He said, no, it's not on there. I was like, that's a really good idea. So as you can see, or maybe not see, but I replaced the one yesterday with Nathan's idea, breathing. Okay. Oh, glad I have my props close by, because today we are talking about breech. So breech is the position of the baby when the baby is presenting with either their bottom or their feet first. So the way that the most effective and way for a baby to be born is head down. And let me grab my pelvis as we talk about this. So the baby is really designed to work head down. So, enter the pelvis, make its way through the pelvis. We have a great video on the pelvis, and when we talk about dilation and effacement and everything, it's really the best, ideal is for baby to present head down. But that doesn't always happen. Sometimes babies will present with their bottom down, like this. So breech with their legs up, or actually come through the pelvis with their feet that way. Okay, so that is breech. Now, when you are pregnant, babies move around. They're mostly in this fetal position, but they can turn around in your uterus and change positions, which is totally normal. But right around that third trimester, the 30 weeks or so, they generally tend to do less of those big flip motions because there's less room in there and sometimes less amniotic fluid in there for them to have the ability to make the big movements. So, and as the pregnant person, a lot of times it's hard to figure out what is going on in there. You might feel like they're kind of hitting you from both sides, or hitting you with their feet and hands at the same time, and sometimes it feels like that. But sometimes, and oftentimes, if we have providers that are hands-on, who do more of the feeling of our belly, trying to figure out whether our baby is head down position or in a breech position, we might know a little bit earlier on their position. And the main takeaway really from breech is that the sooner that you have an idea of whether your baby is in a breech position or not, the better. And the reason for this is some of our options that we have for turning a baby who is breech to head down vertex. The sooner that we know that, sooner we know that we need to work on turning a baby, or if we want to try to turn our baby, encourage turning the baby, the sooner the better, really. It's very hard at a 39-week appointment, a 38-week appointment to find out that baby is breech, and then try some of these techniques that I'll talk about in just a little bit. So I always like to encourage my doula clients and childbirth ed clients to ask when they're at their appointment, is the baby head down? How do you know? Can you show me? What does it feel like? And that really helps encourage our providers to share that information with us and check themselves. And the reason we care is that in most places at North America at least, babies who present breech, who are in the breech position in that last month of pregnancy, that 36, 37, 38 weeks of pregnancy, usually if they're presenting breech, oftentimes our care providers are scheduling a cesarean birth. So baby can no longer be born vaginally. Now, there are some providers around the U.S., rest of North America, that will do a breech delivery depending upon how the baby is presenting. And in certain cases, they will be able to offer a vaginal breech, which, sometimes families feel like that's a good option for them and sometimes it isn't. But if we know that our baby is in a breech position sooner rather than later in the pregnancy, there are a few things that can be done to encourage that rotation. I'm going to put some links below because I can't cover in depth in this wheel video some of the ideas about turning breech, and there's resources out there that are much better than what I'm going to be providing you right here, but I want to list a couple of them. One of them is called moxibustion, and that is done usually at an acupuncturist, and it is a technique where there is the acupuncturist can encourage the rotation of the baby. I'm going to give some more links below so that you can find out some more. There's also some positionings that we can do to encourage rotation of the baby. There are Spinning Babies is a great website that I like to refer my clients to for if they have a breech baby. They can do some inversions, which encourages turning. Something that I don't need to add a link for, but it's something kind of basic, is putting some cold frozen pea bag on your belly to encourage baby to move away from the cold, and maybe having like a warm washcloth on the other side of your belly or a heating pad to encourage the baby to move away from the cold and towards the heat. Kind of simple, like low-tech techniques, but have been shown sometimes to move a breech baby. Now, sometimes we have babies that are persistent breech, that no matter what techniques and tips and things we try to encourage, baby will be, it's just, there's no turning a baby that's breech. So baby will be born generally via C-section. And what's interesting is that sometimes our breech babies, after they arrive earthside, is they will have their legs kind of up near their face, just even when they're laying in the bed. It's really, they're really used to that position. So the big takeaway I like to make sure that my students have with breech is knowing your fetal position as soon as you can, and and then you can check on these techniques. So if you're newly pregnant, you're watching this video, I wouldn't research all of the breech turning techniques right now, but remember to ask your healthcare provider at your visits if they can give you more insight into which way the baby is turned. Okay, I've been waiting for this one. Doulas. I just mentioned I was a doula. This is a topic that I could talk all day about. However, I will try to keep it concise as can be. First of all, let's get some terminology set up. There are two types of doulas: birth doulas and postpartum doulas. So those are different. When I talk about doulas, I'm going to talk about birth doulas first, and then I'm going to cover postpartum doulas, okay? So if you are excited about hearing about doulas, hit the like button and let me know, or enter a comment below if you've had a doula, are a doula, or are thinking about using a doula. So birth doulas, I like to describe doulas as childbirth coaches a bit. They are your support people in labor. So what doulas do is they meet with couples. They're usually hired privately. Couples meet with doulas, and doulas find out exactly how what a positive birth experience would look like for their clients, and then their job is to help make that happen. And they provide emotional support, informational support, physical support, all types of support during labor. So when you're in labor, usually you call your doula, give them an update. At some point, your birth doula joins you, and stays with you through the duration of labor and about an hour or two, depends on the doula, afterwards. During that time, the doula is doing everything from reminding you to stay hydrated, go to the bathroom, and suggesting comfort measures. It's almost like everything that you might learn in a childbirth class, you don't have to necessarily remember. You just need to be familiar with, because the doula will be there to help you remember in birth. I love that about doulas, that we can really be that guidance hands-on. So doulas work really well with partners. So contrary to what some people might feel, adding a doula does not mean that you are going to push out a partner. Dads and partners are going to have their role can be enhanced by a doula. A doula can really help partners feel more comfortable. They can give partners guidance and support them as well. Now, doulas do not provide medical or don't do any medical procedures. So a doula is not going to perform a vaginal check, is not going to do fetal heart tones, nothing like that. A doula is only there to help you reach your goals through that supportive role. So besides in labor providing support, giving ideas, reminding about preferences, doulas also help kind of facilitate communication with your care providers. So if there are difficult conversations to be had, or if you need to figure out your options, a doula helps facilitate that, but a doula will not speak for you. So they're not going to walk in and say, she wants this. It's going to be more like, now, what did you want? I know you wanted this. Let's talk to your doctor about how to make that happen. So a doula is really your go-to support system during labor, and all the way through, and then usually helps with initial breastfeeding. I have so much more information on doulas that I will put in my links below. Now, those are birth doulas. Postpartum doulas are amazing, and they step in after the baby is born. So a postpartum doula comes to your home. Usually postpartum doulas set up a series of hours of booking a few days after your birth, and really help you in your recovery, help your family transition into parenthood. So they do really a host of so many awesome things, helping with breastfeeding, helping with management of the household, coordinating meals. You might even be holding the baby, helping soothe the baby while family gets a rest, family gets a shower, giving tips and hints on great baby care, looking at your setup and where you've got baby sleeping to make sure everything is safe and there's safe sleep, and making sure that mom's recovery is going well with nutrition and with food and hydration. Postpartum doulas really help that transition period after the baby is born. And you might hear the term night nurse, which is a little different really from a postpartum doula. Night nurse is often someone who comes in at night and takes care of a baby while family sleeps. Postpartum doula's role is to help with that healing and that transition into parenthood, and it might include overnight care of the baby for sure, and soothing in between breastfeeding sessions or feeding and that kind of thing. But it is a little more focused on, their role is a little more focused on the healing of mom as well as just holding baby and taking care of baby. So some doulas in some areas are covered by insurance. Sometimes you can pay for doulas with a health savings account, an HSA account. I really recommend, if you have a baby shower and you would like donations to your doula fund, have somebody coordinate that as well during a baby shower or any kind of party for your baby for the upcoming birth. If doula support is something that you're looking for, you can see if you can request that as part of a shower. Also, picking your doula is really important. So you want to meet with doulas in person, interview with them, and see if you have a good interaction. I think interaction is one of the most important things to look for when you're hiring a doula. And I will do a follow-up on interviewing a doula because I think that is really important, and how to choose a doula that works for you. So let me know what you think. If you have questions about doulas, again, I could talk all day about doulas, but I will try to wrap it up by letting you know that birth is such an important time in our lives, and the addition of a doula can really help you meet those goals and make it a positive birth experience. Doulas are not magic. Having a doula there doesn't mean that nothing bad is going to happen or that labor is going to go smoothly, but it does mean that you'll have someone there to support you and guide you and help you along the way. That one-on-one private attention is really priceless, in my opinion. I know I certainly enjoyed my doulas.